Welcome. This video contains useful information about the pediatric hepatitis A vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas. I'm a member of the Navajo Nation and a resident physician in family medicine. I am partnering with Native Boost to bring this presentation to you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost's patient education tools, you can visit www.nativehealthresources.com, click on the Resources tab, and filter resources by the Native Boost campaign. Okay, let's get started. Today, we will discuss essential information about hepatitis A disease, hepatitis A vaccines, and current vaccination recommendations for infants and children. I will also share useful talking points you can use when speaking with parents and caregivers. Finally, I will offer some additional resources. Let's take a few minutes to discuss hepatitis A infections. Hepatitis A is a viral infection first identified in the 1970s. Prior to the availability of vaccines, hepatitis infections in the U.S. were most common among children 2 to 18 years of age. It is transmitted by fecal-oral contamination. Humans are the only host, and the infectious period is 1 to 2 weeks before symptom onset until about 1 week after. Most cases of hepatitis A are mild and self-limiting, and they require no specific treatment. Symptoms are more common in adults than children and can include dark urine or clay-colored stools, diarrhea, feeling tired, fever, joint pain, loss of appetite, nausea, stomach pain, throwing up, and yellow skin or eyes, also known as jaundice. Beginning in 2016, an increase in hepatitis A cases were seen in persons using injection drugs and experienced homelessness. 71% of these cases resulted in severe disease requiring hospitalization, and 3% were fatal. This unusual severity was driven by age, primarily adults over 20, with underlying comorbidities. To prevent acute infection, particularly in outbreak settings, unvaccinated patients exposed to hepatitis A should receive post-exposure prophylaxis with immune globulin or hepatitis A vaccination within 2 weeks of exposure. Now let's take a moment to discuss the ins and outs of the hepatitis A vaccine for infants and children. Two versions of hepatitis A vaccines are available for pediatric use in the U.S., Havrix and Vocta. Both vaccines are inactivated virus vaccines. They are preservative-free and both contain small amounts of aluminum. Hepatitis A vaccine is highly effective at preventing hepatitis A infection. Both vaccines have demonstrated clinical efficacy in randomized trials of 84 to 100% effectiveness at preventing hepatitis A infection. Population studies have also shown efficacy through demonstrating a 95% decrease in reported hepatitis A infections from 1996 to 2011 following the introduction of the vaccines. Both vaccines have demonstrated safety in clinical trials with common local side effects in being injection site pain, redness, or swelling similar to that seen with placebo. Systemic side effects such as irritability, drowsiness, loss of appetite, and fever have occurred in up to a third of recipients. Documented severe adverse events associated with vaccination were seen in less than or equal to 1% of recipients. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated based on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccine Adverse Events Reporting System, or VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendation published in the CDC immunization schedule. ACIP is a group of clinician researchers, public health experts, and at least one unaffiliated community member that meet at least 3 times per year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. Based on this thorough process of data collection, review, and determinations by ACIP, hepatitis A vaccine recommendations have gone through several updates. Initially, when hepatitis A vaccine was introduced in 1995, it was recommended only for those at an increased risk. Beginning in 2006, ACIP recommended that the vaccine be given to all children beginning at 12 months. In 2019, the recommendation was expanded to include vaccination of persons experiencing homelessness age 1 year or older. A year later, in 2020, ACIP further recommended vaccination of all children and adolescents aged 2 to 18 who had not previously been vaccinated and all persons with HIV as early as 1 year of age. Current recommendations for routine vaccination of children are that all children 12 to 23 months of age should receive 2 doses of hepatitis A vaccine. The minimum interval between doses is 6 months. There's no maximum interval for giving the second dose in case there has been a delay. For catch-up vaccination, hepatitis A vaccine can be given at any time to children from 12 months through 18 years of age, with 2 doses given at least 6 months apart. The only contraindication for hepatitis A vaccine is severe allergic reaction or anaphylaxis after a previous dose or to a vaccine component, including neomycin. The only precaution is moderate or severe acute illness with or without fever. When it comes to vaccine recommendations, you may have thought, if only there was an app for that. Well, there is. The CDC Vaccine Schedules app is a great resource for hepatitis A and other vaccine recommendations. It is available for download for free for both iPhone and Android phones. The app is continuously updated with the latest immunization schedules for children and adults. It also includes catch-up schedules for people who may be under-immunized, as well as the most recent information on vaccine precautions and contraindications. To recap thus far, we have discussed hepatitis A disease and vaccines, as well as current vaccine recommendations for infants and children. Now we will discuss strategies for talking with parents and caregivers about hepatitis A vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke with over 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal community members from across the region. Through speaking with community members, we have learned that they want to learn the basics about the disease and why vaccines are important via face-to-face conversation with trusted medical providers. That's when educating parents and caregivers, it is important to take time to discuss the hepatitis A infection as well as the potential consequences of not vaccinating against it. Something to keep in mind when speaking with Native people is that it is vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making the providers feel like they were being challenged, parents and caregivers commonly said they avoided asking questions about concepts or words that they did not understand. So, as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information to your patients. When it comes to speaking with your patients about hepatitis A infection and the potential consequences of not vaccinating against it, consider saying something like this: Hepatitis A infection spreads easily. It can cause liver disease and death. At times, people who are infected don't show any warning signs, but they can still pass it on to others through infected food, water, and close contact. Thankfully, there are vaccines that can help protect us. Then consider letting parents and caregivers know just how effective hepatitis A vaccines are by saying something like, I let my patients know that Hep A vaccines are effective. They significantly reduce the chance your child will get sick. If they happen to get sick, which is unlikely, their illness will probably be mild. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about vaccine safety, make sure to let them know that since Hep A infection can result in serious health issues, we have been regularly vaccinating kids against it in the U.S. since the 1990s. Since the vaccine was approved, millions of Americans have safely received the vaccine, including American Indians and Alaskan Natives. Make sure to remind your patients that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind that serious reactions to vaccines, like the meningococcal vaccine, are extremely rare. You're more likely to get hit by lightning than have a severe allergic reaction to any shot. Based on Native Boost research, it's important to normalize mild vaccine side effects. Make sure to emphasize that after receiving the Hep A vaccine, like any vaccine, children may experience mild side effects. Consider saying something like, when it comes to the Hep A vaccine, common side effects may include fever or pain, redness or swelling where they got the shot. Mild side effects are a good sign that your child's body is preparing to fight the Hep A infection. Within our bodies, each of us has warrior cells, also called antibodies, that stand guard and attack disease. Vaccines like the Hep A vaccine help our warrior cells see and fight disease. For example, when we get the Hep A vaccine, the ingredients in the vaccine tell our warrior cells how to recognize and fight against Hep A infection. Sometimes, when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not a sign of illness. They are a sign your child's body is getting prepared if needed to help to fight Hep A infection in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize thus far, we have discussed the importance of educating parents and caregivers about the basics of Hep A infection, as well as the potential consequences of not vaccinating against it. Based on our research, we emphasize the need to use clear and concise language, void of medical and scientific jargon. We also offer language that can be used when discussing Hep A vaccine effectiveness and safety, and the need to normalize the experience of mild side effects. Now we will discuss strategies for sharing culturally resonant messaging with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated when asked about effective messaging around vaccination. Tribal community members commonly express the desire for providers to emphasize the benefits of vaccine from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers of their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. As medical providers, it's critical to listen to patients' concerns, take the time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and their family. To enhance your knowledge about Hep A and other vaccine preventable diseases, there are a few resources I'd like to share. One is the Epidemiology and Prevention Vaccine Preventable Diseases, also known as the CDC's Pink Book. This comprehensive manual details information about vaccine preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been a few changes made to the schedule. To ensure you have the most up-to-date information, make sure you check out the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedules app. Finally, if you would like to access culturally resonant patient education materials offered by Native Boost, visit www.nativehealthresources.com. Also check out www.indiancountryecho.org/boost for additional training for medical providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together we can increase the number of Native kids who are protected against Hep A and other childhood illnesses.